Alright guys, this is Ty, the Asian Wonder, your online personal trainer. In this video, I want to talk about rehab basics and some of the basics that it takes to rehab any joint in your body, whether it's your neck, your shoulders, your elbow, your knees, your back, any of these things, okay? Now, there's several things that you can do. Number one is, the first thing is whatever you did that caused the pain or the injury, you need to back off of it. For example, if you've been practicing MMA and you're having elbow problems, or you're having knee problems or hip or back problems, reduce the intensity of it. And remember, the intensity is the capacity of your work. So for example, if you can strike at 100 miles an hour, throw jabs at 100 miles an hour, right? Reduce it down to where you're only jabbing at 30, 40 miles an hour, so that it gives your body a chance to heal. You can still practice your form, but it gives your body a chance to heal. The same thing, if you have a pulled hamstring, for example, right? And you're playing football or you're sprinting or like something like that, you don't have to sprint full blast at your full speed. You can run at like 20 or 30% speed and focus on your form. And you can even do it on a treadmill so that you can focus on your form more and focus on your technique. There's other things that you can focus on. So that's the number one thing that you need to do, is that whatever caused the injury in the first place, start backing off of it so that you can give your body a chance to rehab. The second thing that you want to do is start taking some glucosamine chondroitin formula. Every joint problem that I've seen, it has some great benefits on it, and if you guys know, I don't recommend too many supplements on my training blog here, because I'm totally against supplements, but there are a few that actually work and it actually benefits the body, and I actually believe in it, right? So the glucosamine chondroitin formula is actually one of those things that actually helps to heal your joints, and I recommend it because there's supplements that when you stop taking it, it doesn't heal no more, the effects are gone, but the glucosamine chondroitin formula is actually, whenever you stop taking it, the benefits that you got from it are still there even after you stop taking the supplements. So that's what I like about it, and that's the reason why I recommend it. Be careful, because I don't recommend any kind of drugs or any kind of pills that mask the pain of your joints. For example, like Tylenol, like ibuprofen, like Aspirin, or any of those painkillers that mask the joint pain, I don't recommend it. The reason why is because when you mask the pain, your body does not know to go and heal it. Pain is a good thing in the body, folks, because it allows the body to know that it needs to go in there and heal that area. So if you cut off the pain and the body does not know there's pain there, it won't send the necessary nutrients and the necessary building materials, building proteins, to go and rebuild that area of the human body that's injured. So make sure that you have some slight discomfort and slight pain in that area that you're trying to heal and recover and rehab, so that your body knows to go in there and fix it. Otherwise, it won't know. So pain is how the body knows to heal something. The other thing that I recommend is that you use an ice pack, an ice bag, okay? And I don't recommend that you guys buy those at the store where it has that blue gel in there and it freezes, and then you go and you wrap it on your joints. I've used that many times before, and my clients have used that, and I don't recommend that because it doesn't envelop the joint correctly, and it doesn't produce an even coldness around the joint. So what I recommend is you get a pretty heavy-duty trash bag that's about the size of a basketball, right? And that you can make an ice bag about the size of a basketball or the size of a soccer ball. And what I recommend you do is you fill it up, half that bag, which is about a chunk just imagine filling up half a basketball with ice, right? And then filling it up to the level of the ice level with water, with cold water, and tie the bag up and put it inside a cotton t-shirt, such as the one I'm wearing right now, and then lay it on top of the area that needs to be rehabbed. So the ice is used to train after you do your training exercise and your rehab exercises. What you would do is you would quickly put the ice bag on there and ice it down and heal it, right? And the way that it heals is this: it reduces the swelling, because when you train, the muscles get pumped up and it starts to swell, and the swelling pinches all the nerve and the blood vessels, and it prevents the body from pumping blood and nutrients to that area, that rehab area, to try to fix it. So what you do is when you put ice on there, it reduces the swelling in your blood vessels and your arteries and your veins and all the area, and so it allows blood to flow smoothly without any of the swelling and without the pinching of the blood vessels on top of it, okay? So you definitely want to use ice, and that really helps. Now once the pain is gone, then what the next stage of the ice treatment is you want to do what we call the hot cold or the yin and yang treatment, right? And so what you would do is you would go into the shower, or if you are playing the NFL or in college sports, anything like that, they have hot tubs that you can fill up with ice and cold water, and hot tubs that are just really hot. And what this does is it's a really powerful way of recovering and rehabbing your body. And this is something that the Japanese use for the sumo wrestlers and the martial artists over there. What you would do is you would immerse your body, your entire body, inside the cold ice tank of water, or the bathtub full of ice water. And what that does is it cools the body down, right? And it reduces the swelling. And what happens is immediately when you jump into the hot tank of water, it heats up your body and expands it. And what this contraction and expansion of your body and your muscles, what it does is it forces nutrients and blood to start flowing smoothly. Remember, the key to good rehab is proper blood flow so that nutrients can go into that area and fix that area. So after you use the ice treatment, I would go into the hot cold treatment. And if you don't have a spa or a hot tub, you can always use your bathtub at home. I've used it myself, where I go in there and just grab a couple of bags of ice, dump in half a tub full of water, and then what I would do is I would jump in there and cool myself off, and then jump out, right? And then flush the water out, and then put hot water on top of me. Now, that's not a very efficient method unless you have like 2 showers in your house. You can put the ice water in one tub and then run into the next bathroom and rinse yourself with hot water and back and forth. And what you would do is you would stay in the cold water or the cold ice water for about 2 to 3 minutes, and you can feel it. You can feel your body contracting, and it won't contract anymore. And at that point, you want to jump out and jump into the hot water or the hot tub, and then let your body expand, and you'll feel it inside. You pay attention, you'll feel your body expand back out, and when it cannot expand any further, then you jump back into the cold tub of ice water again. And you would repeat this cycle of hot, cold, one dip in the cold ice tub and one dip in the hot tank. That would constitute one cycle, and you want to do this for like 3 to 5 cycles, depending upon how much your pain tolerance is. Now, sometimes I get lazy, so after like a heavy set of squats or a heavy set of deadlifts training day, what I would do is I would actually go home and turn on the cold water and just rinse, shower in cold water as cold as I can. I'm freezing my ass off, you know, and I would do that for like 2 or 3 minutes, and then immediately I would switch it over to hot water and let my body expand. Now, this works just as good too, and it's very convenient. Anybody can do it at their house. So make sure that you employ this hot-cold treatment, this expansion and contraction method to your body so that it can heal it. Now, if you're looking to just rehab a particular joint, like your elbow or your shoulder or your knee, what I would do is I would just run the cold water on my knee or the cold water on my elbow in the shower, and then after a couple of minutes, when you feel that the contraction can't contract anymore, then what I would do is I would run the hot water on top of it. So it's back and forth, and again, you would do it for several training cycles. The next thing that you want to do during the rehab process is, as soon as the pain is over, as soon as the surgery is over and the sharp acute pain is over and you're able to move that joint again, you need to strengthen it immediately. The biggest mistake that I see in a lot of people that's going through, like, for example, like shoulder surgery or knee surgery or hip replacement surgery, any type of surgery like that on the joints to fix anything, is that they wait too long and let way too much scar tissue build up. Now, where does scar tissue come from? Scar tissue is the scaffolding that the body has to build in order to pull something together and fix it. So if you have torn ligaments, torn tendons, right? The body has to build a temporary scaffolding like this so that it holds it in place while they actually the body goes in and actually repairs the tendons and the ligaments. And when the tendons and ligaments are done repairing, that scaffolding still sits there, and that scaffolding is now called scar tissue, and it needs to be removed from the body as fast as possible. And the way that it's removed is by movement. By moving it, that joint, it breaks up that scar tissue, folks. It breaks it up, and then your body flushes blood into it and pumps it out of your body. Now, what happens is if you wait too long after a surgery or an injury to that joint, what happens is that scar tissue, the longer it stays there, the harder it becomes and the harder it gets, and so it actually becomes harder, and it's actually more difficult for the body to flush it out of the body. And that's what causes a lot of the pain and the lack of flexibility and the lack of joint movement in the joint. So make sure that as soon as the sharp acute pain is over with, that you go in and you rehab it and strengthen that joint back up as soon as possible. The next thing I want to talk about in rehabbing is that you want, well, after you start the strength training and the rehabbing process, the next thing you want to do is slow, small increments. That's the key to proper rehab and physical therapy, is small increments. Now, I had a client when I was working at Gold's Gym. She was, I think, in her 70s, 72, 73, and she just had one hip replacement surgery, and she had 2 knee replacement surgery, and she was walking on a cane. And the doctors, the surgeons, the physical therapists told her she would never be able to walk without a cane again. And when she hired me as her trainer in her rehab to help her with the rehab and get her strength back, right, there was 2 things that helped out. One was that she didn't believe in the doctors and the physical therapists. She didn't believe that she had to walk and use a cane for the rest of her life. And she hated the fact that she had to use a cane because she's never had to use a cane in her life before until all those surgeries came along. So I promised her that she would do what I show her, that we would actually get rid of the cane in 2 weeks. And the way that I did it was that we went through small incremental steps, right? We add 1 rep, we add 2 reps, and we do the increment slowly. So for example, when I had her do the bench squats, I had her do it at a high level altitude with the bench at a high degree of angle, and then she would work it, and we would slowly lower the bench until she got to a full range of squat. Right? And after she got into the full range of squat with her knees, I would hand her a 2.5 pound weight, and she would squat with that, and then we'd move up to a 5 pound weight, move up to an 8.5 pound weight, and move up to a 10 pound, 12.5 pound, 15 pound. And it was a gradual small increment that allowed her within 2 weeks to walk without a cane, and she was so happy. And you can do this too. If a 70-year-old client of mine can get off of a cane after 2 weeks of after 2 knee surgeries and 1 hip replacement surgery, you can do it too. So don't think it's not possible. So good. I hope those few tips, guys, were able to help you out with your rehab endeavors, and I hope that you take advantage of it and apply it towards your rehab as soon as possible, and don't let yourself get all scarred up in that injury or that joint, and then lose mobility and flexibility in that joint for the rest of your life. So good luck with your rehab endeavors, guys, and make sure that you take advantage. I made some specific videos to rehab certain specific parts of the body, such as neck, shoulders, knees, back, things like that, elbow, and they're very, very common injuries that people get in sports and just daily life. So I specifically made videos to help you rehab those and strengthen those. So take advantage of them, and if you have any questions or have any comments, just leave them on my training blog for me, and I'll try to answer them as soon as I can.